connecting now. So we'll get started. And for the benefit of those who've just joined or are watching this recording, thank you very much for coming this week. I ran another session last week. I've provided a recording. If anyone still would like that, let me know. And there's another document that I'm happy to share with people. So I think I'll just email everyone that registered for this. The document covers how to structure interview responses, which I'll be touching on tonight as well. And then next week the topic is avoiding common interview mistakes. But some of those are sure to be mentioned this evening also. So for those of you who I haven't met before, my name's Anita Fletcher, and I started Standout Medical Careers in 2020, having worked for the AMA for 5 years, running their career service in New South Wales and then for federal AMA. So I essentially work with a lot of doctors in different specialty fields and at different stages of their careers, helping them with their CVs, applications, interview skills. I see someone's asked a question about the volume, so thank you for that. And I'll let other people in. Yeah, is the volume okay now? Okay, good. Sophie says that. Okay, good one. Thanks, Joy. Nice to see you in here. So yes, helping people with interview skills, career planning. One of my clients I've been working with for almost 2 years now. We meet weekly, and he's been making some great strides with various interests that he has, a very senior clinician. But on tonight's topic, we're all here to talk about interviews. So essentially, these are the main aspects that panels are assessing. So the clinical judgment, there's often a clinical question within an interview, but really the focus tends to be on finding out information about you, what your characteristics are, what your strengths are, how you contribute to teams, because they know that you've got the clinical skills given you've provided your CV and often very detailed history of your career activities, education, and learning. So they're really assessing the behavioural types of skills and what you're like personally. So they're looking at professionalism, communication, insight and self-awareness, leadership potential, cultural fit, ability to work with others, and trustworthiness under pressure. They want to know that you can deal with the pressure and also manage things well when they're not available and in emergencies. So generally, and at the end, I've got a slide that really summarises the 5 questions that I think are pretty predictable in interviews, and then there's variations on those themes. So we'll get to that. So essentially, your clinical abilities gets you shortlisted, and your ability to convey relevant information on your CV. And the communication is where you'll get over the line and get selected to go through to the next stage or to take up the position. So I was extremely pleased this morning. A client I was working with this year has been offered a few interviews for the state rounds for the ophthalmology training program. And, he was always a really strong candidate on paper, but needed to work on his communication skills. And he took the advice on board, did the practice, and rang me, a very happy man, this morning. So essentially, you really have to be able to perform well at the interview. And other people today have said to me, it's hit and miss, or this week, I mean, it's been a very busy time. A lot of people are getting ready for their interviews, and quite a few people have said, sometimes I perform very well and other times I don't perform so well on the day. So I really urge people to think about what are those factors that may contribute to your poorer performance days, and what makes you sort of shine on the day and clearly communicate what you have to offer. That's sort of the $60 million question, but my belief is that the preparation and the practice is really the most surefire way to being able to succeed consistently. So the interviewers are really asking themselves these questions when they're assessing people. And their questions are really built around these themes, these pieces of information that they want to know about each of the candidates. And of course, sometimes great candidates miss out because there was someone with just a little bit more of something else, whether that be CV points or referee scores, personal assessment, amongst the panel as to who they think the best candidate's going to be in the position at that time. So many different factors come in. But really, all of these, I'm sure, wouldn't come as any surprise for you. But one of the things I'd like to stress is the last line in italics. They're not looking for perfection, they're looking for evidence. So you need to be able to talk about and explain why you make a particular point or can demonstrate a particular skill. What I've been finding is a lot of people feel really shaken when they, start a sentence in not an ideal way, or they slip up slightly and you can see they've really been unnerved. That's always going to happen. And even the best communicators trip over sometimes when they're speaking. And the key there is to regroup quickly and continue on with your response. And I'm finding that people are really preparing so much that sometimes then it causes them to potentially miss the question, because they start hearing the question and they think it's about one thing, but the question actually ends up being about something else. So they've gone off on a completely different tangent. So, the really important is to first listen to that question, and often it's 2 or 3 parts. Make sure you've understood it, ask for clarification if you need to, and then go on and give the rest of your response. So don't panic if you're lost for words for a moment, or you need to stop a sentence because you realize it's going in the wrong direction. Regroup and continue on. They're going to forgive you for those little slip-ups. And it's much better that you really show what your professional self is like in communicating in these settings. And certainly you're under pressure in the interview process. There's no doubt about that. One person was telling me the other day that their interview consists of the candidate sitting in the middle of a circle of 10 panel members. And I find that that's probably about the most intimidating setup they could come up with, to be sitting in the middle of the circle like that. So it really also helps to understand who's on the panel, how many people are on it, and really essentially how much time you've got, because a 10-minute interview is a very different situation than a 30-minute or a 40-minute or a 60-minute interview. One of the people I spoke with today said, yep, I know it's 10 minutes and 3 questions. So that's a very short encounter with this panel of 8. But that is because that's the last stage of this process. They've already gathered a lot of information about the candidates by the time they get to that point. And now it's a me to check these people out, check out the candidate, see that they're going to be a good fit and they come across well, they can carry themselves well in a formal meeting situation like that. And of course, safety and reliability are always essential characteristics to be able to convey. So sometimes I see really strong people perform poorly. As I said, sometimes people are a bit hit and miss, and there can be lots of different reasons for that, even what's going on for them that day. But as I alluded to earlier, I've seen a bit of over preparing happening lately, and you run the risk of having this answer that, as I mentioned, may not even answer the question. And the other thing that I'm noticing with a couple of people this week was they're speaking so quickly because they are trying to cram in enormous volumes of information into a 2 minute time frame. And I really encourage them to slow down a bit. It's better if you are clearer and are able to express your points. You don't have to go into a great level of detail in most occasions. Convey the main points that you're trying to get across. And delivery goes a long way rather than the risk of them not even catching what you're saying, or that you start rambling and you go down the rabbit hole and get lost in an answer and start providing detail that is not required. And sometimes I notice people also over explaining concepts. The people in the room know what it means when it's something that's happened in the clinical environment in that specialty. So just be aware of not having to over explain points. The anxiety can really get in the way for some people as well. And again, that's where the practice and the preparation really pays off. It calms people down because you're able to then be confident that you have prepared well enough and you can take that in and give it your best shot. Structure is another really important aspect of this. So I'll send the notes I made about a few structures because a panel will see when somebody's structuring a response by virtue of the way, the order of the information that comes out and the way that you're making your points. And then sometimes people are, yes, focusing on the content but neglecting the delivery. So sometimes I see people who are looking down when they're concentrating and they're not making any eye contact at all. So I train them out of that. I coach them out of that. And sometimes people are looking around when they're concentrating. You have to remain engaged with the people in the room or over the Zoom call, and it can be hard to stare into a camera, especially if it's for 2 hours or an hour or however long it is. But you need to really show that you aren't distracted or going to distract them in some way. It's quite off-putting. And then when I think of other body language things, fidgeting is also can be an issue. So if you notice yourself doing it, pick yourself up. I notice I just turned in my chair and stop it. Just sit still and focus and engage with the panel. So how do you sound confident without sounding rehearsed? And, there is a difference. There's preparation and practice, and there's rehearsing and learning a script. So stay away from trying to script the ideal answer and your exact wording and the whole thing, because you'll only come unstuck with that. It's very unlikely that you're going to be able to predict the exact questions that are being asked. There'll always be a twist somewhere. And as I said before, if you go in with this mindset that and think, oh yeah, that's what they're asking me because it sort of conveniently matches what I've prepared, I think this is the right thing, you run into the danger of not answering that question. And I do come across that from time to time. So prepare your experiences and examples. I've got another document on examples, and I'll happily share that with you all as well. A few people have said they've found it really helpful, and it's not a set of examples. It's a worksheet to help you build out 6 to 8 really strong examples that you can adapt to different questions during the interview. Prepare for the theme. So, as I mentioned, I'll bring those up at the end, including conflict and communication, and you know, most of the things that most of you are familiar with now. And I see there being 5 to 10 key themes, and really they're often based around the competencies of the specialty. And then prepare some frameworks so you know that when you get asked a particular style of question, you think, okay, that they're asking for communication and leadership there. When have I demonstrated it? Right, where's my great example about that I'm using? I'm using that, and here's how I'm starting, and I'm going to work through that. So, you know, you will get there with the preparation and practice. And I see it all the time with my clients. Once they've caught on to really what they should be doing, you're all pretty quick learners, and they're able to, I see really good results. And so I've already really talked about the problem about scripting. It can be very off-putting. That comment sounds robotic. One of my clients this week said that one of the feedback from one of the consultants in their department's practice that they've been doing together said to all the candidates, you all just sound so bored. You're all a bit monotonal, and you need to, inject a bit of energy into it. And so I was really encouraging my client. I saw her do that in our practice session after she told me that. And I said, well, you'll see if go back and watch the recording. So try and vary the way that you're speaking a little bit to maintain people's interests. And you might want to use hand gestures occasionally. I'm doing that now. I often notice newsreaders or, people in current affairs reporting, and sometimes they hand gesture away and it's just too much. So you want to strike the right balance of something that's natural, but that you can interject and use your hands or some other variation of your communication style during that response, rather than getting on this flat line and staying there. People are going to start thinking about dinner, what they're making for dinner that night. They will switch off and they won't hear the response because it's not capturing their attention. So prepared candidates do these things. I say to people, try and sound natural, be yourself. They want to see you. They don't want to see the, false interview version of you. They want to meet the candidates and see what they think they'd be like to work with and how they'd communicate together. And I'm always saying to my clients, what are the key things that you want people to know about you? So those key messages and key examples. And some people in the room here I've worked with before, and you'll know that when I work with you, when we start, one of the things I ask people is, what are the 5 things you want to make sure that panel knows about you when you've left the room? Because it's very easy to leave those things at the door, come in and just respond to the questions, and then walk out and say, oh, I forgot to tell them I'm finishing my PhD, or whatever it is. So be very mindful of what those key messages are and what you want to convey about your practice. because they're all ears. They've invited you in to hear you say what you want to say to them in order to gain that position. So, and just remember also that those people who are sitting there have been through what you're going through now. They're very empathetic towards it, or sympathetic, and they still have to go through those interview experiences in their own careers. So they're on your side and they're not judging you, they're assessing you. And there's a big difference, because I think a lot of people can feel quite intimidated and feel like an imposter, and that the panel is somehow really scrutinizing and judging them. They're not. They're listening to what you're saying and they're making an assessment on it based on the criteria for the role. So really, you can't be anyone but yourself. So don't even try. Don't try too hard. Speak like you normally speak in a professional manner and you'll be fine. And try not to panic, which sounds easier said than done sometimes. But if you're, again, with the nerves, the preparation and the practice will really help you feel more confident. And you've got to walk into that room feeling calmly confident, because people pick up on it. They pick up on you the second you walk in before you say anything. So people ramble for these reasons. Definitely the nervousness, definitely the lack of structure, most certainly trying to include too much information, and their fear of missing something important. So they keep going. And I've more than once I've said to clients this week, stop. That's it. You've said it. Don't just keep going, because you have to stop at some point, and you're better off stopping when you've answered the question than spending another minute on nothing that's adding any value. In fact, it's actually starting to work against you. And then you're ready for the next question and you haven't wasted that important minute, which is a very big unit of time when you've got a 10-minute interview. So you have to use that time extremely well. And one of the ways you do that is, as I mentioned before, through using structures, a structured approach. So I will email this to everyone who's registered, and the other example building resource that I hope will help. And on that document, there's more than these. So even these structures, even if they help you get started on an answer, they're really worth considering and thinking about and adapting or adopting, because often people hear a question and then they think, I'm not sure how to start. How do I start the sentence? And often people will repeat back the question, they'll paraphrase it back to the panel. And that's okay, but I wouldn't do it, certainly wouldn't do it in every question. I'd probably do that once if I had to. But you're better off not doing that, because the panel knows what the question is. You're better off getting straight into the answer with a strong opening line. And I've got some in here that we'll get to. But even saying, one of my favorites is, my approach is this, because they want to know how you work. And so by getting straight into it, in these situations, my approach is to do this, 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 and this. And showing them that you have a method to the way that you work, and how you collaborate with the team and solve the problems that exist for the patients and the team. So yes, that's a little on structure. So how to improve clarity? See, then I had a moment of silence. It didn't really worry anyone, did it? And what I find is some people can't pause. They just need to keep a word or a sound running constantly. They're kind of afraid of the silence, but it's not long. If you draw a breath or pause between sentences or points, it's not a long time. and the panel won't notice it really, except in a good way. It shows that you're comfortable with a pause and you're considering what you're going to say next. It shows that you're not panicking and trying to make a sound or a word every time a sentence finishes. And I use that example because I'm often saying to people that people who put in between or something else, some other filler words, when you've concluded a sentence, you need to pause on the full stop. And then you start your next point, and that will really engage people more. It's almost counterintuitive that the ongoing monologue is less engaging than when you vary your tone and your way of speaking and intonation and pausing. So really, don't be afraid of doing a pause. It's all right. The panel will hardly notice, and even if they do, they won't consider it a bad thing. 2 or 3 seconds. It's okay to stop and come up for air every once in a while. And when I worked at AMA New South Wales, I was on an interview panel day that we were running a training session for the members. And one of the doctors told a story. A consultant said, the longest pause, we had a candidate who paused for 30 seconds at the start of every question. And I don't recommend doing this, by the way. But that person, the panel came to realize very quickly in 1 or 2 questions that thinking time enabled that candidate to give the best answer. And she said, we gave that person the job because their responses were so good. But yeah, I think that's a very risky strategy. I wouldn't keep them waiting for 30 seconds. But it goes to show that if you invest in some time doing whatever it is that makes it work for you, it can very much pay off. So yes, think about your answer as well, structure, then respond. You don't have to dive headlong in a panic and race off with your answer. Calm down a bit, show that you're confident and comfortable in that space talking with them, and deliver your responses to them. You know, I often say to people, listen to the way the consultants speak at work. They're not in a hurry. You know, they're considered, and people listen to them very well and very attentively, and they're able to communicate. In most cases, I find that their knowledge and the points that they're trying to get across to whoever's listening. So there's a few of those examples that I touched on. You know, I'd highlight 3 things. The rule of 3 is really helpful in interviews. I'm sure you've all had a go of that, of talking about 3 key points relating to that question. So you set it up in the introduction, see, straight into it, not here's the question again for you to hear because you've just told me that. It's I'd highlight these 3 things and go and deliver the 3 things and explain them a little bit, as much as you have time for, and then wrap it up. And then, you know, it starts to take on a more conversational tone rather than in the response of someone who's being interrogated, because you're not being interrogated, you're being interviewed. And one of my clients said that this week as well, that one of the consultants said, you know, have a conversational approach. I know what they mean. I wouldn't quite go as far as to say conversational, but it's I think what they mean is that more naturally speaking and delivering your response in a way that is more about, this is a 2-way dialogue here. You've asked me a question, now I'm giving you an answer to that, and they're listening to that and it's not a conversation, because then usually they don't go on to ask follow-up questions, but on the other hand they can. So in that sense, it would very much start to feel like a conversation. And I think a lot of the more senior roles end up with that kind of format. When you've got an hour interview, you can go into that territory. But with a 10 or 15-minute interview, there are set questions for every candidate in the interest of fairness, and the interview panel usually don't stray from that. So it's a structured process, and you fit into that structure with structured responses, with good starts, good ending, and very good content in between. And then the panel, as I said before, can see when people are using a structure with their responses. They identify it quickly. Okay, so there's a little bit more about pausing. I think I've already covered all of that. And, definitely reduce those filler words. There's another filler phrase, and so take notice of when you're doing it. Don't beat yourself up or panic if you can't shake the habit before the interview. Try and be mindful of it and avoid it. And hold your tongue, pause instead of filling that space with one of those fillers. Handling difficult questions under pressure. I met with someone this afternoon who's applying for advanced training in cardiology, and she said to me, it's the difficult situation questions that are the hardest for me, managing a conflict, or I can't remember what the other examples are, but these types of questions listed here. So what they're looking for with a conflict with colleagues, they don't expect that you don't have them. They want to know how you deal with them, because they know that there's conflict in a working environment where the people are under pressure, and for so many reasons, and different types of people are working together. So what they're looking for is insight into your understanding of those situations, why they come about, how you manage them, and that you can do that in a professional way that keeps the team culture together. I was working with someone else yesterday who's applying for anaesthesia training, and he really brought his skill of listening into those types of questions. And he said, I find that's one of the most powerful tools in working with people and resolving conflict, is to really hear the other person or the people out. And normally, and I would very much agree with this, when people feel like they've been heard, they immediately calm down. So you can de-escalate by really genuinely wanting to hear someone else's views. In terms of clinical errors, again, panel members know they happen. They've all made them. They want to know that you take responsibility for that, and how you address it, and what you learn from it and take away from it. Same with weaknesses. What are you doing about them? Or have you had a weakness and overcome that? How did it change your practice? How did the mistake change your practice? That's the insight. That's the stuff they're really trying to get to, not the detail of the event itself. They want to know how you responded to it. And again, unsuccessful applications. Do you handle those professionally? People get them all the time. Everyone goes through that at some point. But it's necessary, and they're looking at how you can overcome the disappointments in your career and setbacks. And again, they're not judging you on how you do that, or that you've had setbacks, because they understand what people are up against. So, just don't take things too personally. It's not a personal examination of you. It's an assessment of the way that you behave in these difficult situations. So I mentioned a framework before. So, acknowledge what's going on, recognize the issue honestly, explain what happened, provide the context, and steer clear of making excuses. Nobody wants to see that. And yesterday, that's below the line thinking. Yesterday, that client and I were talking about above and below the line behaviors. So in business, in the business world, people talk about that. It's below the line, and that means that's the territory that you're not supposed to be operating in. You're supposed to be operating in the above the line professional behavior with integrity and honesty and all of those qualities. If you want to look up above the line, below the line, you will probably get a good model. I should put one in my slides sometime to think about, check in on and self-reflect on your own behavior, and that's what they want to see. And they really want you to see how you learn and how you respond to feedback and how you give feedback. Because whether it's a specialty training role or a consultant or a fellow role or whatever stage you're at, it's required of you. It's part of the system that you give and receive feedback. So they're very interested in the way that you learn and what you do with the challenges that you're faced with, and the opportunities as well. So when things are going right, you're reflecting on that as well to show that you're looking for the qualities that made something work, so that you can replicate that, whether it's a particular style of work or a procedure, whatever it is. So be ready to give the winning stories also, or the examples where you've performed well, I should say. And everybody wants to see your improvement. The questions you weren't expecting, people often refer to these with me and they can be quite worried about it. The key there is, again, to take a moment and think about it. They're often called curveball questions, and there's no right and wrong answer to those. The panel is asking those to see how you react in the situation where you didn't see something coming. So show them that you take a moment and consider that, and then give them your answer. And keep it short. And if you say something's an interesting question, or I'm often hearing that's a tricky situation, say it again once in an interview. Don't keep leaning on that every time as your opening line in your interview. And I have heard some people doing that, and we've ironed that out, because it becomes, it's not impactful. You need to elevate your responses to be more interesting responses than always saying the first introductory line. So in terms of common communication mistakes, I feel like I've been guilty of the first one already this evening, speaking in long, uninterrupted blocks. But so that is something I notice with some people. And that's where we work to build in the structure, get comfortable with a pause, and, read the room. And you can react according to the panel, but don't get too caught up on what the panel are doing. Try to just stick to your game plan, because often they're using tactics to see how candidates respond as well, such as being stony-faced. You've probably seen it. Or not making eye contact themselves. So be aware if that's happening. It's not you, it's just what they're doing. And you have to remain focused on the questions and your responses, and don't disengage from them even if they're not looking at you. You still need to address the room as though they're all, giving you their full attention. Yeah, so failing to understand the question asked, as I mentioned, I come across that occasionally. You don't have to use a lot of technical jargon, and most people I've worked with don't do that. They're very good at demonstrating their ability to speak in layman's terms. Lack of reflection can be an issue, so make sure you know you've got a good example of a mistake or a weakness, and when something hasn't gone quite the way you hoped it would, or you've had a setback in life, these are all interview questions that you can be asked. So show them that reflection, and also conversely, again, on what you've done well and when things have gone well and what were some of the contributing factors to that. Defensiveness is never a good thing to see, particularly in an interview. So just park that outside. You don't need to be defensive against them because, as I said, they're not there to get you. They're there to see you do well. No panel wants to see anyone sitting in that chair struggling. It just hurts everybody. They don't want to see it, so they're not going to hopefully make people feel too uncomfortable. Talking too fast and giving excessive background information, as I said, too much information sometimes. Your body language is really important as well. I'm noting the time. I keep looking over at my clock, so I'll move through this fairly quickly. I think it's pretty obvious here. I've touched on some of these things already. So really come across as professional and calm and engaged. So one of my clients this year, he was so not calm, applying for a consultant role that he really wanted. And after a few sessions over a few months, he had calmed down and he was so much stronger and much more confident and natural. He was able to, in our last two sessions at least, I saw him really getting into the swing of it. So, as I say, if you work on it, you'll address the areas that you need to work on. Managing your voice and delivery. So slow down a bit because you are going to speak faster than normal in that setting because of the nerves that are pushing you on. So strong candidates project confidence, avoid rushing, vary their tone naturally, and speak at a measured pace. These are all things that you can practice doing. Get a free Zoom account, sit in front of the camera and record yourself and practice. And over time, you will certainly improve. Professional presence, I think, is a good topic to bring into this as well, because I really like those words. I notice people who are composed and do all of the other things, demonstrate confidence even when there's uncertainty, an uncertain situation. And often uncertainty questions is an opportunity for you to bring in other team members. And that's possibly going to be a teamwork question or how you escalate. So getting help, you would know by now from other people, your colleagues around you and other healthcare practitioners, is not a weakness. It's actually the way the system is designed to work. So own those things and own your achievements without coming across, and you won't. So many doctors worry about coming across as being boastful or arrogant. I rarely see it. I had that conversation with someone today. Think about it as you providing the information that's going to help them make a decision, not I'm going to sound like I'm showing off. Don't hide your achievements. The interview is a place where you need to present that information that you've also presented them prior to entering. So speak out loud, do mock interviews, record yourself, and take feedback from others, because the feedback that I hear my clients getting from other people is spot on. I can identify it as well. And you're really doing a service to someone by helping them develop and by giving honest feedback that's going to assist. So there's this, that's the, I think, the recipe for success. Do work on those different areas and show your adaptability through your communication skills, structured thinking, reflection, professional judgment, and storytelling. So with that, I mean, as I referred earlier, to having solid examples that you can adapt to different situations. It's part of that. So even knowing how to use the tone in a particular relating to one situation, using the same example, you might use a slightly different tone. And you'll be engaging the readers, as I've said, if you vary your delivery at times. So confidence comes from preparation, not memorizing answers. Trying to memorize things will only make you more stressed and feel that you're going to fail on the day, because chances are you won't deliver exactly the same words that you tried to memorize, and your house of cards will tumble, rather than having the really strong foundations of strong examples, good structures, preparation, and practice. Um, and that's, I guess, pretty much all we have time for, and all I wanted to cover this evening. I think I've touched on all of those themes. Oh, briefly, as I mentioned, the types of questions. So people want to know a bit about your background and where you're headed, your plans, your goals, your objectives, whatever you want to call it. Have those ready to take in so that you can say to people, well, this is where I'm trying to get to here, why I want to work in this job, and what I'd like to achieve in this role. And longer term, medium and longer term, these are the things that I'm looking to do. And people are really interested in that. And when I ask people that question, they tell me things that there's no way I would have known that from their CV if I hadn't have asked them. So panels will naturally want to know that information too. General skills comes into it, and clinical skills, uh, behavioral types of questions, as we've mentioned before. Tell us about a time you did this. Looking to the past to show the way that you behaved is, used as an indicator of predicting how you will behave in the future, or demonstrating the work processes and your approach to different types of problems that you're comfortable using, that you can convey that it works well for you and everyone around you, and that's the way that you're continuing to develop in your practice. And the questions will be tailored to the level and the specialty that you're at. But I still find it remarkable how similar a consultant's interview questions are. Of course, there's variations of themes that they're exploring, because there's different responsibilities in the role and different expectations. But, across the board, people are looking at very similar things. And then sometimes a curveball question. And the final question, which is often, do you have any questions for us? And I provided some feedback. Somebody asked me about this last week, and I might put that in the email as well, because they said it was really helpful. Here's a small summary of that. So they're looking to see genuine interest in the role, your strategic thinking. You're thinking of what is it going to look like to be in this role? Where's the department going, and how can I be a part of that, and how can I help achieve the department's goals? And they're looking for maturity in practice. So that calm confidence also indicates maturity. And I always know it when I see it. And I'm sure that they do as well. And I'm sure you would if you're on the other side of the table interviewing other people. So here's a couple of example questions that you might like to use. And on the other side of this, yes, it is okay to say no, thank you. I feel like I understand the role very well, and I'd like to restate my keen interest in this position. If offered the position at this network, I would certainly accept it. I love living in this area, and I'd like to thank you very much for your time today, and I look forward to hearing the outcome. And ended on a highlight that you don't have to ask a question, but you can if you want to. Make it a good question, though, not about rosters or something that you could have found out outside the interview room. And if anyone would like any assistance, please feel free to get in touch with me anytime. You can book a free session and we can have a chat about what's happening for you. There's my email address on the bottom. And thanks very much for registering and coming along this evening, and I hope it's been helpful. I'll stop the recording now, and then if anybody has any questions that they'd like to ask, you're very welcome to stay back and ask those. And otherwise, I hope to see everyone next week as well. Thank you.
Thank you very much. That was an amazing